Hi, my name is Neal. I'm just going to speak briefly on a few points of the science that that I'm highlighting specifically because I want them to be useful to the people here who are organizing. And so all I want to cover is 3 points. I want to talk about 3 lies that are being told by policymakers and give you a sense of, okay, what the real truth is and how to counter those lies. So very kind of practical, need to know organizing stuff. And obviously there's a lot more lies than just what I'm going to cover, but I'm going to cover a few of them that are that just come up all the time from politicians, from school district administrators, and need to, we need to be able to fire back. Lie number 1 is we're doing something. We are taking action to keep people safe. We're doing this and this and this, and we have this requirement, this protocol, and we have a rubric, and this is one of those things like the environmental crisis. Everyone can say they're doing something and nothing is being done. Everything keeps getting worse. The most of what a school district is doing in their policies is just telling you enough, whatever they have to say, the minimum of what they could possibly do to convince people to come back to school so that the parents of the children can go to work and be making more money in the economy. You cannot take any of the public safety measures just by themselves, and you can't skimp on these things. And in the safety measures, we need to be talking about vaccines, masks, testing, contact tracing, quarantines, and subject of this meeting, shutdowns. These are not an either or proposition. All of these things are necessary. In many cases, a school district is only using so much in the way of masks or testing just to avoid having to do shutdowns. But that is a tactic that cannot be taken off the table. It's an essential thing. And just a few quick words on each of these. With vaccines, there is no excuse for vaccines not to be mandatory. For decades upon decades, it has been completely normal for students to need to be vaccinated for measles and mumps before attending school at all. And we have, abundant evidence, overwhelming evidence now that being vaccinated makes a person many, many times less likely to be hospitalized and less likely to die from this pandemic. And if you ask any hospital worker, any healthcare worker, what their priority is for the public, vaccines are it, because that is what affects their hospitals the most. This is the measure that most greatly reduces hospitalizations and deaths by more than 90%. And what that means is the majority of hospitalizations and deaths from COVID, the vast majority of them, are preventable. There's no need for them to happen. It could have been prevented to begin with. So if a district administrator is not talking about mandatory vaccines for all, they are not serious about protecting human life. It is just such a simple, commonplace measure. If you have the opportunity to save hundreds of thousands of lives and you don't, where do you really draw the line between negligence and mass murder? This is such a basic thing. Masks. We now don't know that most cloth masks do basically nothing, but we have very good masks. The typical surgical mask, which is very cheap, is around 60 to 70% effective, but we could do much better than that. The very best mask is the N95, which is around 95% effective. There are a couple other masks that are over 90%, which are the KN95 and the KF94. Those are very good. The N95 in particular for children comes in small sizes, child size masks, the best possible protection. So N95, KN95, KF94, those are in a class of their own. Those are the only things you can get that are more than 90% protective. Those should be available to everybody and they shouldn't be optional. They are certainly more expensive than the typical surgical mask, but human life is worth that cost. It is worth paying for. Testing. We now know that with Omicron in particular, the virus has evolved to a point at which it is very hard for the rapid tests to detect Omicron. So if you take one of those really fast do-it-yourself tests, you can get a false negative very easily. And that is turning the rapid testing system into just a way of keeping stuff open and making it look like fewer people are sick. The tests that will accurately find Omicron the best are the PCR tests. It's where you get the nasal swab really high up in your nasal cavity and it's analyzed in a lab. And so if we're talking about testing, we need to be talking about effective testing, not the old, rapid tests that you can find in a grocery store, which were optimized for a previous version of the virus and aren't recognizing Omicron. So when we're demanding testing, we need to understand some of this testing is being used as kind of a fraud at this point. Contact tracing, quarantines, some of the most basic things, but then also just the essential thing that we're here to talk about right now, shutdowns. Before this pandemic occurred, just a few years ago, everyone knows what happened when a school has an outbreak of measles or mumps. The school closes down. It's so simple. This was like basic, basic procedure, basic medical, best practice, just a few years ago, even though it feels like ancient history now. COVID-19 is much more dangerous than measles. It's much more deadly. And it is rapidly becoming more infectious with every new variant. This practice of being able to close things down to get the situation under control has been universally rejected by politicians of both parties, by the district administrators, and we are going to be the only real force. Organized students, parents, teachers, community members. We will be the only real leadership to fight for this basic policy that has, been essential forever. If you have a deadly outbreak going through a school, shut it down. Stop the outbreak. Very simple. And all of those best practices in healthcare policy need to be on the table. You cannot say this or that. The Supreme Court, rejected Biden's vaccine or vaccine or test policy for big business. And that was a terrible decision by the Supreme Court, but the policy itself was too weak. Vaccine or test, those are completely different measures. They do not accomplish the same thing. They are needed for their own reasons. And both vaccines and testing need to be mandatory as well as masks. You cannot just pick and choose which ones you like, which ones are most convenient, which ones are the easiest for getting people back to work. In that Supreme Court case, there were businesses that claimed that the vaccine or testing mandate would cost them billions of dollars. And that argument should have been thrown out of court because the vaccines cost nothing. The federal government already paid for all of that. They cost a school district nothing. They cost a business nothing. There is absolutely no excuse for anyone to fail having a mandate. This is just a simple question. Are you serious about keeping people alive? That's all it is. The fact that there has been such a universal failure to implement most of these measures is a sign that the real policy is to keep the money flowing, and that they are perfectly willing to sacrifice hundreds of thousands of lives if that's what makes the rich richer, and that's the crime that we're up against. Lie number 2. Cases are going down, the surge is over, we can all go back to normal. This has happened now multiple times during the pandemic. And part of the lie of this whole thing is obviously just pretending that evolution does not exist. Evolution has brought us wave after wave after wave of the virus, and will continue to do so until the pandemic is over. Pandemics do end, but it usually takes a long time. And the rule is it ain't over till it's over. The evolution of a virus follows a very simple pattern. The more it spreads, the more it creates mutations. The more it creates mutations, you have more diversity of the virus. And so you have more competition to see which variations of the virus are best at reproducing. And when something gets really good at reproducing and is an improvement, it's a new variant or a new strain. And so we have been through this multiple times. We had the original wave of COVID that began under the Trump presidency. Once that wave started going down, CDC said, cases are going down, everyone can go back to normal. That disarmed the public, leaving everyone vulnerable for the next wave, which was when we were hit by the Alpha variant. And that one came almost immediately after the original wave. And that was, that really began in the very end of 2020, beginning of 2021. And when that subsided, the CDC committed the ridiculous crime of saying, we can all go back to normal. You can take off your masks if you are vaccinated. Everyone can go back to school, go back to life as usual, as long as you're vaccinated. That left everybody, including vaccinated people, vulnerable for the wave of the Delta variant. And they started sending people back to school in the midst of the Delta outbreak. And then when Delta started moving down, and they said, okay, well, this wave is over. So, as long as you're vaccinated and your family tests negative, go do your holiday vacations and meet up for Thanksgiving, meet up for Christmas. That disarmed everyone and left everyone vulnerable for now Omicron. And, this virus is looking a lot smarter than our public health authorities. The virus keeps changing, keeps getting better, and the authorities keep doing the same stupid thing, disarming the public and leaving us vulnerable for the next and the next stage in the evolution of the virus. And what that does is it allows the virus to evolve that much more rapidly. The more spread you have, the more transmission you have, the more evolution you have. And that puts all of us at risk, even those who are vaccinated, because it can allow the virus to evolve in a way that bypasses some of our vaccine protections. So this is just a lie that has to be confronted. Evolution does exist, and it ain't over till it's over. And we need to be, we need to be prepared to battle every single phase of this pandemic. And it will not be the same pandemic. It will not be the same virus from beginning to end. And we have to be able to respond accordingly. And the third lie and last point I'll make is kind of the obvious one. And it's the lie you hear every day. The schools are the safest place for our children to be. And you hear that on the news every day. We've covered this before, and I'll just run through some of the basics again. There are plenty of studies, and some of our previous stuff that we've put out, and even in our recent flyer, there's a reference to the study in the Journal of the American Medical Association. Closing down schools dramatically reduces the numbers of cases, the numbers of deaths, and the rate of transmission in the community as a whole. The study was published in JAMA, the Journal of the American Medical Association, showed that school closures reduces the numbers of deaths by 58% in what we've seen in the United States, and it reduces the number of cases by 62%. That's a reduction of more than half. And so it means our public health officials and school administrators know that when they are opening schools, they are doubling, more than doubling, the number of cases and deaths. They have health advisors who can give them this information. And when they are opening schools during a surge like we're having, and this is the biggest surge we've seen so far, they know they are dramatically increasing the number of people who die. That is about the most irresponsible decision any leader could make if you're responsible for anyone. And we are in a situation in which COVID is getting better at infecting children, and hospitalizations of children are at their highest. One of the symptoms that is particular with Omicron in children is called croup, which is a very distinctive cough and hoarseness and labored breathing. It has a recognizable sound to it. And also all the usual symptoms, loss of taste and smell, high fever, chest pain, fatigue, brain fog, none of which are good for learning, none of which are good for staying alive. This is many times more deadly than the flu in children. It is, back in 2020, when we had versions of the virus that were not as good as infecting children, COVID was already the 7th leading cause of death in children in that year. And we can barely keep up with what are the implications for the for the Omicron variant, and overall in the United States, COVID is the 3rd leading cause of death for everybody, and for elderly people above a certain age, it's the #1 cause of death. And okay, we know why these policies are so bad. We know in order to get parents back to work, you have to get kids back into school. This is about keeping the economy, running red hot. There's an article out today showing that during the pandemic alone, just during the short window of time, the world's 10 richest men doubled their wealth. And that is blood money. That was at the expense of hundreds of thousands of lives in the United States and millions of lives all over the world. And we are not going to sacrifice the lives of the nation's children, the nation's parents and teachers and everybody for the sake of helping those billionaires make more billions. This is an emergency. This is our time to fight. This is our time to lead. So I'm just going to conclude with that, covering those three lies. There's a lot more we can cover, but we have some organizing to do. So let's talk about that and talk about how to get these strikes and shut these schools down. So thank you.